Welcome to the Age Gracefully Show with Dr. Michael Grossman, the well-known anti-aging stem cell and regenerative medicine specialist, best-selling author, and founder of the OC Wellness Clinic in Irvine, California. Each week, he shares the latest information to help you look and feel your best so you age gracefully. And here's your host, Dr. Michael Grossman.
Welcome. I'm Dr. Michael Grossman. We're here to talk about fully. Today, I want to focus on what I do as an anti-aging physician to keep your body youthful and repairing any kind of injuries that occur over time. As men and women get older, injuries get more common. That we find that happen is that as we age, we can maintain muscle strength by vigorous exercise, and our muscles can be just as strong as they were when we were 20 as when we're 60 or 70. However, our tendons and ligaments don't stay as strong. Tendons and ligaments don't have very much blood supply, and when they get injured, when they get stretched, when they get torn, they don't have the ability to heal and repair because there's no blood there to create that repair process. Whenever we get injured, there is a repair process that occurs, and that is you get bleeding, you get a clot form from the platelets, and then the platelets create a fibrin matrix that allows the body to temporarily hold things together like a glue, and it releases then growth factors. The growth factors go out and tell the body there's an injury here. We're maintaining it with this glue, but please come in and repair. And the body's intelligent. It sends in repair cells, stem cells, and these repair cells go into that area and analyze, well, what's the problem? Is it a nerve that's torn? Is it a muscle? Is it a tendon? Is it a ligament? Is it skin? Whatever the injury is, the repair cells will go in and repair that area with the right kind of cell. It's a magical process that's designed in a very intelligent way, and we don't have to think about it. We just know that, oh, I hurt my finger and it's kind of throbbing and aching, which is a good thing because then the body gets a signal, okay, there's a repair process that needs to go on. Sometimes that repair process gets very inflamed, and as a physician over the past 40 years, we would often inject cortisone into an acute injury that's gotten all swollen and painful. And if we shrink down the swelling, sometimes it helps the repair process to occur because then the tendons and ligaments can grow back together instead of being all swollen up. And there's a value to a cortisone injection, but cortisone generally doesn't help the repair process beyond just shrinking the swelling down temporarily. When we have an injury that's been going on for some period of time, what we need to do is to create a stimulus in these repair cells. So if you have an elbow injury in the tendons are what attaches from the muscle into the bone. It's very tight ligament. Very little blood supply. If that gets injured, it can get swollen and red and tender, and that can last for months or years. Sometimes the tear gets worse. Elbows, we call a tennis elbow. That could last for many years if you don't have a method of repairing it. Shoulder injuries, big problem with shoulders. Oftentimes you need to have surgery on shoulders because if you tear something that's completely torn, the body cannot, even with stem cells, repair it together. If it's too completely torn, you got to take a stitch and tie it up together. Then you could use cells after you stitch it up. But most of the injuries are partial tears, where the tendon is torn, but not completely torn, and it's sort of like it's holding on, but not really well, and it hurts in moving and turning and twisting. If we have a method of repairing those torn tendons, we can avoid surgery. Now, knees are a big problem as we get older. and the knees have a cartilage substance in the middle. It's like a bagel. It has a hole in the middle, and then there's a whole lot of spongy support. And so the hole in the middle has a lot of fluid in it, and that bagel-like substance, the meniscus, can tear. And you usually get just mild tears in the beginning, and then the tears get worse over time. And as you continue to walk on it over the years, it gets worse and worse. And then the doctor comes and tells you, oh, you have a worn-out meniscus, you have bone on bone, you need to have surgery to either remove the tear and hopefully have enough cartilage left to let your knee work, or maybe you just need a new knee. We're going to put in a knee replacement, take out your knee and put in an artificial knee. So those surgeries can be good, and people can do nicely from those surgeries. But 80% of the time, you don't need the surgery. You can repair it through natural methods of stimulating these repair cells to come into that area. So let's look at a typical tendon ligament injury in your elbow, in your shoulder, and what we can do with those injuries. First, easiest thing to do is to use what we call platelet-rich plasma. We take your blood, like we would in a blood test, get about 60 cc's of blood. It takes a half hour to spin the blood down and concentrate the platelets in the blood, which contain the growth factors. And we concentrate it to about 6 to 7 cc's of concentrated platelets, and we inject it back into whatever part of your body has been injured. Could be a very mild knee injury, it could be a shoulder, it could be an elbow, it could be any part of your body that's been injured. And when we inject the platelets in, you get a signal sent to the body that says, oh, there's some kind of injury here. Please bring in the repair cells into this area and let's repair whatever the damage is. And the body sends in repair cells. Over a period of 6 weeks, it will repair the damage. And so you get 6 weeks of ongoing repair, and then it kind of levels out. It just sort of stays at that level over the next years. Now, if you get only 50% better, well, then maybe we'll do another one to get you to be 90% better. You want to get the tendons, ligaments, cartilage to heal at least to where you're not having any pain, so that you're not continually wearing and tearing on that injury. It goes away, the body's saying, oh, I'm okay with it now. It's doing good. You don't have to repair 100% of the cartilage. So when your doctor says, oh, you're bone on bone, or the doctor says you have a tear, if you just take away the pain, that will be sufficient to stop the process from getting worse and will stabilize the process, and everything is going to stay the same. You can do more of the platelet-rich plasma, and it's harmless. There's never a side effect from it. It's your own body's healing mechanism. We can use the platelet-rich plasma to also heal scars on the skin. If you have an ugly scar on the skin, you can use cortisone to shrink it down, but to actually get it to heal and strengthen and look more normal, platelet-rich plasma, very, very helpful for healing scars. Healing wounds that don't heal is fantastic for healing wounds that are not healing, because it brings in the repair cells into that area. Now, when we inject it into a knee, we inject it into the joint, and the body will put cartilage back in. When we repair it in a joint, if you've been told that you have worn out the cartilage, if you just put enough cartilage on so that the cartilage covers the bone, so the bones in the knee joint can become kind of like hills and valleys. And in the valleys, you still have some, the hills, the cartilage is gone, therefore you're bone on bone. But if the cartilage grows from the valleys over the hills, then the pain is gone, you have cushion, and as long as you're not running marathons, you're going to feel fine. Marathons just wear and tear everything. So that's platelet-rich plasma, which is a very easy, harmless treatment. The next thing to consider is that we can add other things that if you have a more substantial injury that's been going on for many years, and the tearing and the cartilage is really worn considerably, We have the option of adding exosomes, which are growth factors that we take from the amniotic fluid of babies. And the exosomes are signaling factors that will also more intensely send out a signal, oh, please repair this area. Exosomes are harmless. They're real simple injections. Get them frozen. And it's harmless because unlike taking stem cells from babies, there's no DNA in these exosomes, so you're not getting any possibility of autoimmune reaction to someone else's DNA. We also have other products such as Interfil. Interfil is a concentrate of the from a newborn baby from the placenta. We can take a variety of growth factors that act as a glue in any kind of an injury in a joint to kind of hold everything together and to allow the cartilage to have a matrix to grow on. So that's another thing that we can add in. So all these are very, very harmless ways to harness your own healing power. As you get older, you lose the circulation in different parts of your body, particularly tendons, ligaments, and cartilage. And it makes it more difficult for the body to repair. So these are simple ways to bring in that natural healing power of your own body. Now, there's one additional way I'd like to talk about, and that is we have a acoustic wave kind of technology, which has been used for 15 years in Europe. I've been using it about 5 years here in the United States. It's an acoustic wave, is a kind of sound wave, different from ultrasound. It's a different frequency. The frequency is created to be about 15 hertz, and it's done by having a what looks like a little kind of a gun that has a metal pellet going back and forth very quickly at a certain frequency, and it hits a metal end plate, and it sends out vibratory acoustic waves through your body. And depending on which kind of metal, we can go deeper or more wide or more narrow. And this is dramatically helpful to vibrate the cells and trick the cells into thinking that it's a new injury. New injury means the body sends in repair cells, sees what's going on. It's essentially painless. It feels like a peculiar kind of massage that at the time feels a little peculiar, but afterwards you find out, wow, my muscles are feeling better. It is like the most effective massage for muscle tightness, fantastic for that. But it also has this repair quality to it, that it will repair injury, tendons, ligaments, cartilage, nerve, whatever has been injured. We've used it for years with male sexual functioning problems with erection, but it's so helpful for elbows, knees, shoulders, backs, any kind of a problem, once a week. And I find that most people after one treatment feel improved, even with an injury that's been going on for a long time. Very different than other physical therapy technologies. There's a value to ultrasound, to heat, to electrical stim, to massage. All these things have a value, but this acoustic wave has been a phenomenon of repairing things that otherwise don't repair. So we have so many great methodologies to keep the body functioning healthy. It's so important to have healthy functioning of exercise for your longevity and well-being. So it's not just the pain and discomfort, but it's actually, we want you to be able to exercise as you get older. Keeps your bones strong, keeps your brain young, keeps your mood healthy. Exercise, very important to stay youthful. And these technologies I'm describing are a big part of aging gracefully. So if you want to come into my office for a consultation, be happy to do that. And we can talk about these different options, see if it's appropriate for you. My office is located in Orange County next to the John Wayne Airport. So call 949-222-0232. That's the best phone number to reach me. And I'm looking forward to speaking with you, and we'll talk again in a few weeks. Thanks so much for being with us.
Thank you for watching the Age Gracefully Show with Dr. Michael Grossman. Join us next week for another informative discussion to help you age gracefully. Be sure to visit us at ocwellness.com.